Welcome to another Achieving Science video. This video is all about the development of new drugs. Let's start off with a question. Why don't we have drugs for all diseases? We know about many diseases, but we don't have drugs for everything. Well, the simple answer to this is that every new medical treatment has to be extensively tested and trialled. This is to make sure it does work well and it is as safe as possible. If we look at some of the traditional drugs, the first one we can look at is digitalis. This is used for heart problems, and its origin is from foxgloves. We look at the second drug, aspirin, used daily as a painkiller. Its origin is from willow. And our third drug is penicillin. This is well known, and it is an antibiotic used to kill bacteria. Its origin is from mold. So, new drugs then. New drugs are synthesized by chemists in the pharmaceutical industry, but many of these drugs still have a starting point of a chemical from a plant. If we look at the testing procedure then, and what happens, we'll get an understanding of the process. First of all drugs need to be tested for three things. To see if they're safe, so they're not toxic, to see how effective they are, and to see what dose is required. During this process then, it starts with a laboratory where computer modelling is completed. Then, preclinical trials are to take place using live animals, tissues, and sometimes live animals. The next step, once it's past preclinical trials, it goes on to a clinical trial where healthy volunteers and patients take the drug to see if there are any side effects. This whole process can take up to about 12 years and cost around £350 million just to get the drug onto the shelf. Therefore, this is a very long and costly process, which is the reason why many drugs do cost a lot of money to purchase. So let's have a bit of a closer look at the clinical trials. Our first step is that you don't want to give somebody too much. So first of all, a very low dose is given. The second step is that once it's past that step, further trials are then carried out, again on healthy volunteers, to ensure that it is safe. This is then to identify what the optimum, the best dosage, can be given. Final step is then a double-blind trial. This is where some patients are given a placebo. This is something that does not contain the drug. Patients are allocated random groups so that neither the doctor or the patient are aware who has the drug and who has the placebo, and therefore there can be no bias throughout the process.